Hello, Simon Smale, Consultant Gastroenterologist in York. I thought this evening I would talk a little about an overview of Irritable Bowel Syndrome. Now, Irritable Bowel Syndrome is defined by a number of symptoms which you have to have for a certain length of time, and those are abdominal pain and or bloating and or a change in bowel habit, which may be either diarrhoea or constipation. However, those are also features of other conditions, and so one needs to be sure one doesn't have what are called red flags, which may indicate other diseases. I'll talk a bit about those in another video. In addition, one needs to do some examination, and one needs the examination findings to be normal, in particular for there to be no abdominal masses, for there to be a normal rectal examination, and for there to be no other obvious cause for the symptoms. And then lastly, one needs some investigations, which are pretty standard. Everybody should have a full blood count, everybody should have some inflammatory markers, either a CRP and ESR, and everyone needs to have celiac serology that's negative. There are some other finer details about the investigation. Inflammatory markers in the stool and such like have also come into vogue, and they're now used widely. But I'll again talk about some of those, particularly fecal calprotectin, in other videos. I hope that gives people a broad overview of IBS diagnosis, but then there's also the management, which is of course equally important, perhaps more important. Now the management, it's very important for doctors or other clinicians to try and empower patients to take control of managing their symptoms. Because lifestyle is really key in managing irritable bowel syndrome and indeed many other conditions, and therefore patients need to take control of that, because really the patient is the person that controls the lifestyle. It's no good seeing the doctor one day a year, doing what they say on that day, but not doing what they request or advise on the other 364 days. Perhaps not surprisingly, it wouldn't make much difference. So lifestyle is really important. Clearly diet is an important part of that, and again I'll talk about that more specifically in other videos. We do sometimes use drugs for irritable bowel syndrome, and again I'll go into the specifics of those drugs in other videos, and we do also use some times psychological therapies. They can be very useful for people who don't respond to initial therapies of diet, lifestyle change and drugs, and also other what is sometimes regarded as alternative therapies, including hypnotherapy, which is a very well evidence-based treatment for IBS these days.